and I always just go the closest, whatever, the thumb, their finger, whatever, just measure the two closest points. So he's got a restriction there of 7 inches on the left, arm up. Go this way. And we got 7 inches on the right too. And what you should be able to do is touch your hands together. So every inch of restriction is an inch of tightness that is then going to make it more likely for you to get an injury when you're doing something dumb, like picking up a coffee cup, swinging a golf club. You know, you guys see this. I see it in practice all the time. Guys come in and they're like, oh, I hurt my shoulder. Oh, what'd you do? I unscrewed a light bulb. Oh, what, like a 500-pound gymnasium light bulb? No, it was my little kid's light. Right, that didn't do it. That wasn't the cause. The cause was your shoulder isn't working right, not the activity. This is key. Your patients will not understand that. Mine don't. It's so funny. They always want to blame the activity when it's actually them, which requires taking responsibility and ownership for that, right? So we have to teach them that. So once you see the restriction, then you're going to actually do the treatment. So we'll come in here, shoulder. We're going to go into
this is the circulation of my hand, so I need that
program. And then
we're always treating this one.
We're going to do the motion. So he's going to bring this up and over. Rotator cuff is going to be tight, which we just saw. So what I'm going to do is I'm going to stimulate the rotator cuff while we're putting some movement into that joint as we're moving it. So we're going to move this to the patient's tolerance.
Enjoy it.
Yes.
One of the things you can do too is you can ask the patient, where do you feel the restriction? And then go right after that. A lot of times that will help determine where that tightness is stemming from, and you can chase it around and get it to loosen up. You'll see common patterns with this as well. All right.
Guy needs to tie his hair back. Sorry, I'm very concerned.
And then what you're going to do is you're going to do the other side, same thing. So we're going to come up and over. Where do you feel that kind of pulling on you? Right through here. All right, so we're going to actually hit that area there. And I'm going to stretch this as we're doing it.
He really needs to be moving his arm on his own as well.
You have to work within the patient's tolerance. Obviously, you do what they can handle, but the more you can stretch while you're doing it, the better. Oftentimes, you'll feel it let go. You'll feel it like they're only restricted here, and then as you go, all of a sudden, you'll feel that muscle let go, because remember what this is doing. It's stimulating that reflex in the tissue, making it relax and let go as you're moving it through. Next thing we do is the other part. We're going to do this, and we're going to bring his arm up and down like this while you're working on. Most people with the shoulder issue, they're going to feel it in the front where the rotator cuff tendons all come under and attach.
That's a good one, Isaac, right there, working on the anterior rotator cuff while you're forcing the arm back.
We're going to do the same thing on the other side.
And if you notice, he's not going through the entire sequence. He's just going for a few seconds, then moving the prong. Going a few seconds, moving the prong.
I'm assisting in the movements here. But again, to his tolerance.
Now, Mike, this treatment, therapy, MMT, you're doing it with ProSoft. Everybody can get a ProSoft, but they're not going to have it by tomorrow. If they did this with the Pro Adjuster on the highest speed, they can still do this exact same process. they're just not going to get the same result. And that gives us time to get them the instrument whenever they're ready to get it, right?
Yeah, you'll still see change. It's just not going to be as fast because the speed is the key. And really for the patients, they need to get this moving like as fast as possible. So then we're going to retest this. So bring this one up and over, this one down and around.
Look at that.
And you can see right there, he went from a 7-inch restriction to a 1-inch restriction.
Holy cow.
Ooh.
You see that?
Just one treatment. So yes, I'll take
Bravo.
a standing applause from y'all right now. That's a
Now,
game
wait.
changer.
Wow.
No, this is important. What age category is the patient in?
Yeah.
How old are you?
24.
24 years old, and he had a 7-inch difference in improvement, right? So for him, the longevity of this, we'll call it the retirement bank account that he just added is significant, right?
That's huge.
A person who's 65, sometimes their restriction, it's like a foot. Frank, yours was over a foot. Frank Corbo's was over a foot. You said you're 20.
24.
Yeah, Frank's 74. And I mean, when we were done, he was actually doing the waltz. It was unbelievable, right? So point is that every age category are candidates, Mike. Not to interrupt you, but there was 2 questions that came in while you're teaching. I think they're both really important.
Yeah, and the age, you got to realize. I mean, I have a lady that's 80 years old who can do this test. So a lot of you are going, oh, yeah, well, just you're old, you can't do it. You know what? That's not true. That's called you did not take care of things and you neglected it and let it progressively get worse. You have to be on that. If we were on this with him and we maintained this until he was 80, his quality of life as in retirement would be way better than if we just do nothing, let it all freeze up, and then wait until he's got problems when he's old and try to fix it. That's just dumb. It's better to be on the front end trying to fix it and get in front of it. Bring this one up and over. We're going to measure this side too. So this one, we got a 3-inch there. So we went from 7 inches to 3 inches. So we got a huge improvement there too, over 50% in one treatment. And how many minutes was that?
Yeah.
Just a couple minutes.
Now, Mike, let me add something on because this is important. So you got 3 inches or 4 inches of improvement today, one therapy session. If we did a block of care, those fingers are overlapping each other.
Yeah, it just takes time. If you guys remember muscle creep, right? Creep is when a muscle tightens, then it pulls back to how it was. It's the shape it was in. When you have these chronic problems like this, it's going to take more than one time. It's like fat guy going to the gym. You can't go once and then it just disappears, right? That's not how it works. These muscles have to be changed. And then you want to have them doing these therapies so we get the change to happen. And you'll see magic. I had a young guy come in, like him. He was in college, and he was pitching for our local school for Grand Valley. And he was pitching pretty good, and he came in to pick up his girlfriend who was working for him. We actually said, hey, come over here and check this out. Let's do this therapy on you. He goes, oh, there's nothing wrong with my shoulders. I'm a pitcher, right, for elite school. Well, whatever. We measured him. He had a restriction in his motion. We did the treatment. In one treatment, he saw improvement. Again, he's asymptomatic. That weekend, he went and pitched over 90 miles per hour, which he hadn't done in 3 years. He pitched over 90 miles per hour that whole weekend tournament that he was in. So when you're talking about this stuff, it's not just pain. We're actually talking about quality of life. And in these sporting events, you got to realize it's a game of inches. It's a game of little tiny increments. When I high jumped at Michigan State, Big Ten school, the difference between a walk-on and a full-ride scholarship was 4 inches. If we had this technology where you could have been working on things, you can improve that. A pitcher's pitching faster. A golfer's swinging smoother and hitting the ball farther. Oh, I had a guy come in the other day. He was so mad at me. He goes, I want to tell you, you screwed up my golf swing doing that ProSoft. And I go, what do you mean? He goes, I used to hit my 7-iron 150 yards. Now I hit it 180. He goes, all my yardages are messed up. And I'm like, yeah, you're welcome, right? Like he has huge range of motion improvements, which translate into quality of life and performance improvements, which is what your job is to educate these patients on, because they're not thinking that way. They're just thinking symptom, and they don't think chiropractor for this stuff. The beauty of it, when you look at these icons, is that I have patients that I've seen for 20 years, and they come in and they look at the icon, and then they go, "Oh, you work on knees?" And I'm like, "Where the hell you been?" Like, they never grasped that we worked on knees.
Well, plus, Mike,
all
they
these
believe
years.
in computers. They see it on the screen. I mean, they can't help themselves when they see this technology. Here's a question that came in for you, Mike. And this is an important one to answer. This came from Susan. How long does the correction last? And depending on different factors. So this is going to come up, Susan, particularly if you didn't do the whiteboard drawing well enough, or slow enough, or consistent enough. So when you lay out how MMT works, it has to be laid out to this patient before you touch them with the machine. This is how it works. This is why it works. And when I get the result today, it indicates you're a candidate. Write this word down. It says you're a candidate for this type of care. That means that if we do a block of care will result in a 60 to 70% long-term improvement. Susan, long-term improvement. If we do one block of care, you'll be 60 to 70% better. This is not a one treatment cycle. Do you know why? What I just explained to you, that neuropathway is over and over and over. So listen, I want to make sure you understand that once we get through the first block, this is my experience, you're going to be 60 to 70% better. It might even be higher. For some people, you may not need a second block, but many people do, because we're fixing a long-term problem. The second block usually gets us another 20 to 30%. I'm not worried about the second block. Here's what I found. If you trust me and allow me to do the first block, before the first block is over, you're going to say to me, "When do I pay for the second block?" You will ask me when it's okay to pay. Right? Does that make sense? Okay. Yeah. So Susan, you got to set that up, set the expectations up better, because correction, that word is a misunderstood word, Mike. We talked about this even last night at dinner, right? It's got to be explained properly in the terms we use. Here's another question. I want you to answer this one. Tom Bauer, thanks for the question. Do we offer the ProSoft and MMT to current patients, or do we offer them to just current patients, or would you also offer to new patients?
Well, both. You obviously would want to do both. Part of your evaluation, when I do an evaluation when a patient comes in, we're going to do this test on them, whether they have symptoms or complaints about their shoulder or not. We're going to explain the value of that. We're going to explain the value of keeping that shoulder motion in, keeping it working well, and then maintaining that over time, so that when you're old, you're playing pickleball with the champions, right? So you want to offer that to both, and how you implement that, depends on how you do your exam and all of that. But we always, on the first visit, after we do our evaluation, whatever their area of complaint is, if we have a restriction in motion, like if he came in with a shoulder problem, we would do a demo of the ProSoft on that visit so they could see. But if they don't understand that the restriction in the motion that you measure is the cause of the problem, they'll miss the mark. And that's where so many chiropractors are missing it, because you're going off of symptoms. The patients never are really understanding that the function is the first thing that needs to be fixed, and then the symptoms will go away. The measurement is the key, because if you think we can keep his shoulder working better, do you think he's going to have a better quality of life?
Mike, can I add one thing to the measurements, which I love the system. But when you're measuring this patient, your assistant that I was talking about over there should be snapping pictures pre and post. They snap the picture and put it in the file, because metrics motivate people. They just do. Sometimes positively and sometimes negatively. I'll give you an example. If you didn't have a speedometer in your car, some of you, like some of our presidents of our company, has a heavy foot. He happens to drive a little faster than the speed limit, generally speaking, with his 500 horsepower car. If you didn't have a speedometer that said you're doing 90, John, you'd probably go to 100 sometimes, wouldn't you think? He's turning red. I want to get off of Point is, the metrics measure progress. If we show him 7 inches, we then show him 3 inches. And then he comes back in, and after that block of care, those fingers are overlapping. You couldn't possibly argue the fact that you didn't improve. By the way, balance. Let's talk about balance. You can have a seat over there, I think. We're finished with him, Mike?
Yep.
Okay.